Why are you having tooth pain? This is Dr. Richard Anderson at the Essential Dentist, your cosmetic and holistic approach to oral health. Today we're going to talk about root canals. Root canals are a great way to be able to resolve tooth pain. Let's talk about why your tooth is hurting. The outside of your tooth has a very protective outer shell called enamel. The inside part of your tooth, dentin, is very organic and is very sensitive because there's nerve endings that go into it. So if something penetrates through the enamel, like decay, which is full of bacteria, it will go into the sensitive part of the underlying tooth structure. If it gets close enough, if the decay goes in deep enough, it will actually cause the tissue inside the nerve canal to die. When this tissue dies, it can be very painful. It can be constantly throbbing. It can cause all kinds of chaos in your life. It is not very fun. Eventually, that pain will go away. And when this pain goes away, that's even a worse situation, because what that means is the nerve inside the center part of the tooth has completely died. Bacteria starts growing inside the center part of the tooth, and then it climbs out the bottom of the roots. Once it goes out the bottom of the roots, it goes into the bone. Your body tries to protect itself by forming an abscess. That abscess fills full of pus or white blood cells, expands and causes a lot of pain in your jaw. So there can be 2 rounds of pain with a tooth. Initial pain, hot and cold sensitivity, maybe some throbbing, something like that. And then eventually it goes away and then it comes back again with a vengeance. So what do we do to fix that? We do a root canal procedure, which is removing all that dead and dying tissue and the bacteria out of the center part of the tooth. And that is what a root canal is.